Hi, everyone. Jonathan Brandt, Go Out Living. We are excited to have Jason Gilbert all the way from Australia today. Functional medicine practitioner, 20 years of experience with the World Surfing League, a lot of experience in a lot of different things. And we are so excited to have you. Welcome.
Jonathan, thank you very much for the invite. Congratulations on the podcast as well. I love the title, Go Out Living.
Thank you.
I love that. That's what I'm passionate about.
I appreciate it. So you have, it's a journey. From your own personal journey to your mom's journey, and it's led you to the hyperbaric oxygen. Why don't you go ahead and tell us a little bit about that?
Sure, mate. My journey started, I guess, with our family owning a health food store when I was a kid. And I worked there as a kid, and I was always around or inspired by people, especially elderly people who are active, happy, glowing with health, good posture, all that sort of stuff. So from a very young age, I guess there's a couple of things that I realized that to get to that stage of life, we had to do more than just react when we're feeling bad. Yeah, do more than just wait for symptoms to arrive. And the second thing is that as I got into chiropractic school, traveled to South America, and my early, I guess, experience was doing social programs up in the Andes and the Amazon every 2 weeks and seeing consistent problems with people's spines and going deeper and asking why. Why is their low back hurting? Oh, okay, they're in a bed that hasn't been changed, a mattress that's soft, and they've had it for 20 years, for example. So that's really the other part of my work is to ask why and find the cause. So if someone listening today could just do that, if they're symptomatic, if they're feeling something that's stopping them from going out living their fullest, I would say find the cause. Now, funny, I feel that often we need to go through our own journeys in regards to learning about health, suffer to a degree, to reassess the common definition of health for most people, which is based on how they feel, okay, based on symptoms, and change that to how you function. Yeah, and I had that definition originally, where I waited till I had severe back pain and found chiropractic, and then years later had spinal surgery, literally with a month's warning that I had something wrong, but it had obviously been manifesting for many years. And the other one was having mercury fillings taken out incorrectly, and in that process, sharing that with a patient of mine who was the founder of functional health, functional medicine in Brazil. And he invited me to study functional medicine with himself. He was giving that course to a small group of specialists in Brazil. So in that time, I not only got on top of my mercury toxicity, but I met incredible doctors who worked with me using hyperbaric oxygen therapy. And it's interesting because if we're speaking about an incredible modality that was very well known in the diving industry and hospitals for decades and decades, this has been around for literally more than decades, centuries. The concept of putting somebody under pressure to increase oxygen getting into their plasma, and I'll explain a bit more about the principle in a minute, to a point where when I was doing my treatment back then, alongside many other interventions to boost my health, I was going into a soft cell chamber and I was put under atmospheric pressure of 1.3 atmospheres with ambient oxygen. So meaning that we have 21% oxygen in air, that's what I was getting in the chamber. But with that, I was getting a 30% increase in oxygen to my plasma and noticed amazing benefits. For example, I had a lot of candida and mold in my blood. That cleared up in 2 weeks. So with time, isn't it funny, but everything happens for a purpose. Literally 5 or 6 years later, I had the flu, came back to Australia, gave the flu to my mum, and that's how we discovered she had lung cancer. She coughed up blood. And she was actually told by the doctors that it was too advanced, that it had metastasized and gone to the other side of the body into a different tissue. And it was all about quality of life. So I had her on a plane within a week back to the doctors that I learned functional medicine from in Brazil, people who become friends and people who would, alongside myself, devise a protocol for mum to focus on her health. So this is the thing that a lot of people, when they're in a crisis, understandably, they're focusing on a symptom. They're focusing on something that is unpleasant or they're focusing on cancer and not giving the attention that they need to give to their health. Now, our choice was made for us. The medical profession said, hey, it's all about lifestyle and quality of life now. I should say not lifestyle, quality of life. So we were forced just to focus on their health. And in that time, one of the modalities, this was actually done in Paraguay, but we used ozone therapy. My friend had just been to the Vatican to teach the Vatican doctors about ozone. We did IV supplementation with vitamin C, glutathione, lots of other really good nutrients. We did fecal transplant from me to her because I'd been looking after my biome and my gut for a very long time. And we also included in that a hyperbaric oxygen therapy chamber. And I found this in Asuncion, Paraguay. I'd have mum doing her IV drips and I'd go across town in 15, 20 minutes, straight into the chamber. And back then, poor thing, she was a bit claustrophobic and she'd make sure that I was by her side. But we had a 10% reduction in tumour size in that month. Okay, so all we did was boost her health. Is it a miracle? No, it's not a miracle. But what people need to understand is that oxygen is life. We understand that. That's just a concept that we know that if we block our nose and mouth, we gasp for air. So obviously it's that important to get oxygen to the cells of our body that the brain provokes that response, to be able to get it in fast. What we have to realize is that there's 21% oxygen in air. And when we breathe in, that oxygen exchanges in the capillaries of our alveoli and our lungs. And there's an exchange for CO2. Okay, it is then bound in the red blood cell by hemoglobin and taken all around the body to the mitochondria of every cell of the body. Now, the mitochondria, a lot of people might have heard about the importance of mitochondrial health and that anything that we can do to boost mitochondrial efficiency is fantastic because the mitochondria of the cell with more energy does more, there's more output, and an organ that's working better does its job better. So when you think of the liver that detoxes better, what illness would not benefit from, a lowered toxic state? Neurons in the brain. Not only does it increase their efficiency, but it actually creates new neuronal networks, which we call neurogenesis, within about 10 to 20 sessions in the chamber. It causes something called angiogenesis, the creation of new blood vessels. So you can imagine if there's been a stroke or some sort of damage to the brain or other tissue, the ability to be able to shunt around that is incredible. So I've jumped there to some benefits and I'll come back to more, but the magic in the chamber comes from the fact that if we consider that most of us are 96 to 99% saturated, meaning that 21% of oxygen in air, that 21%, most of it gets to the red blood cell. We can't get more than 100% oxygen into a cell that's already 96 to 99% saturated. However, in the chamber, under pressure, we manage to bypass the red blood cells and get oxygen into the plasma. And this is where the magic happens. So once again, this isn't a miracle. The miracle is what the body does with more oxygen. But when we get that, and there's an increase depending on what pressure you're at 1.3 atmospheres, it's about a 1,200% increase to getting oxygen into the plasma. And at 2 atmospheres, it's around a 2,000% increase. So you can imagine, once again, if we've just recognized that mitochondria do their job better, some beautiful studies that have come out in the last years and decades show that we can actually increase the number of mitochondria. This is absolutely incredible. It increases the amount of stem cells in a very short amount of time. So stem cells go to injury sites, to the immune system, and they boost the body in the way that it needs. They're like little ambulance. I guess ambulances go there and fix up urgent situations, boost the immunity, repair tissue and more. And a really interesting study last year out of Israel actually showed that it increases telomere length. So the telomeres are at the end of our chromosomes and shorten with time, with years. Now, in the past, in functional medicine, something or an intervention or supplement or modality was considered incredible if it could hold that shortening. And now we're seeing that actually can increase the length of telomeres. So you can imagine, that combined with increasing anti-inflammatory cytokines and lowering pro-inflammatory cytokines, it's acting on so many different levels. And this is why I think the chat with you today is so important, because there's so many people listening that might not be aware of mild hyperbaric oxygen therapy and might not either have had exposure to information or be working with professionals who deal with it. But my goodness, one last thing I'll say is that if we fast forward, and Mum's still alive, by the way, it's 9 years later. And if I had photos, I could show you in 1 month the transformation of what vitality, energy, and life did to her body. Like, she's glowing within a month. Hey, she still had cancer. You know what I mean? But she was
Right.
healthier.
And well, here's my first question. This isn't just about cancer, though, is it?
No.
This can solve a lot of different issues. And it's not necessarily a cure, but it's your body fighting it, correct? By giving it what it needs.
Really well said. If we're talking about the word cure, we've got to recognize that only the body cures itself. And unfortunately, when we have modalities that suppress symptoms and cover up the underlying cause in the process, then that cure can seem like it's been achieved. However, if the underlying cause hasn't been looked at, it will come back. Okay, and as we know, it often comes out worse. So this is just a really important tool. And when I say tool, the chamber's the tool. Oxygen's vital for life, as you know. Like, between 3 and 6 minutes without oxygen, there's no more life. So to be able to use oxygen in this way, to get it to where it needs to go, and sit back, combining it with, obviously, lifestyle changes are very important, dietary changes, and recognizing the fact that our health, in order to be able to, enjoy 100% self-function, we need to look at chemical, emotional, and physical factors. And within each of these factors, there are either going to be nutrients or toxins. So let's say if we look at physical, exercise is a nutrient. Too much exercise is a toxin. Puts us in that pro-inflammatory state with cortisol levels elevated for prolonged periods of time. If it's physical, sitting down for a long period of time and not moving, or having a poor posture, would be a physical toxin. The chemical toxins for most people are easy to recognize. That would be, let's say, alcohol, smoking, seed oils, fried food, too much acidity in their diet, whatever it is for that particular person. Those, environmental toxins, things that we're exposed to in our cleaning products or personal hygiene products. And then nutrients, obvious as well. The nutrients that come from our food that please our biome. Because the DNA or the RNA of our biome are distinct, and they react in different ways according to the quality of our diet. And then the last one would be the emotional toxins, which, look, in recent years, I haven't asked for this, but I've received quite a few people with cancer. And one thing I'm seeing across the board, and I'm not saying it's a given for everybody, but unresolved trauma from the past, that stress that people might hold in, just anything internally that's keeping those cortisol levels high. And honestly, to tell you the truth, it's one of the hardest things for me to work with. I'm referring them to people that I know that can support that. But that's one thing. Look, generalizing once again, but the ones that I'm seeing that are getting on top generally have figured that out. They sort it out. They're happier people, whatever it is. Once again, please don't quote me 100%. But if we go back to the chamber, a beautiful thing that I've noticed with myself, and I should say I bought a chamber a year ago, because chambers have improved in quality, where they're able to contain more pressure. They're steel, and we get almost pure oxygen in there, breathing through a mask now. So 80 to 95% oxygen, which is incredible. So what I've observed is that there is a beautiful stimulation of the parasympathetic nervous system. Now, when we look at what things can do that, we're looking at nasal breathing, meditation, yoga, mindfulness, being still, being present, all the rest. that if we can use a modality that also helps us on that level, wow. And what I also forgot to say before, which is really important, is that it causes an obvious and fast increase in white blood cells. I have a microscope off screen here right next to me, but I test people before and after they go into the chamber. And one of the most notable things I see is an increase in the number of white blood cells. Now, what person dealing with any disease or condition wouldn't benefit from having a stronger immune system? So yeah, blowing me away.
I mean, to me, it's we talk about red light, but we basically it's the sun and oxygen. It's a kind of a no brainer, isn't it?
You go. Good quality water, good quality food, sunlight, movement, being present, good quality thoughts, and oxygen. Like, okay, there might be a couple of others, but what I want people to understand is that even though this is a modality that's not always within access or it's expensive to buy, it is still only delivering an essential element of life. Movement, even if I'm dealing with people who are a little bit restricted in their ability to move because they have a low back problem, I get them to move any way they can because movement stimulates the cerebellum. The cerebellum's the homeostatic center of our brain. So movement indirectly stimulates brain function. Good quality diet, we understand the importance, but most people unfortunately don't understand the difficulty in getting access to good, organic, wholesome, locally produced produce. Really important. And water's another one. Water, wow. Once again, under this microscope, I do a before and after with people with, for example, Kangen water, which is pH 9.5, usually on that, hydrogen rich and structured water. And you will see after 2 glasses, changes in red blood cells that were previously stuck together, separated and energized. People are blown away. But my point is, it's simple. Water is simple. We just need to, find water, food, air, movement, thought patterns that were congruent with the way we lived genetically hundreds or thousands of years ago. Because this version hasn't changed since then, genetically.
How do we okay, that's the hard part though right now, isn't it? Finding that because we're used to over here, we run to Walmart, we run to Safeway, we run to that's where we get everything. There's not a lot of some places are lucky, got organic. I'm in the wheat belt or
Yeah.
whatever, so we get organic food all the time. However, those that are in the city, I mean, they're kind of stuck with what is down the street.
Yeah, that's a really good point. Firstly, and I deal with this a lot with my clients, yeah? Whether it be a physical obstacle or challenge in getting it, distance, or as you said, living in the city, or sometimes it's here with people thinking, oh no, but I can't, or I can't take 5 supplements, I forget, or I'm terrible with diet, whatever. Most people are dominated by their taste buds and what they want, as opposed to thinking and realizing the genetic needs of their own selves. Okay, and therefore they eat accordingly. However, that's in the programming of the person, and it's something that we must understand that we are born. If we're talking about a health bank where, let's say, somebody, comparing it to being born very wealthy with millions in the bank, that's how most of us are lucky enough to be born. But nobody ever came at a young age and told us how to invest that, how to spend wisely, how to make your money work for you. So if we treat it like a health bank, how do you look after your health? How do you not just spend? How do you invest? And investing would be what we were just talking about: good quality food, movement, water, oxygen, all the rest. Now, unfortunately, most people only think about their health and they lose it. And at that point, it can be a gamble. Some people will learn from the mistake and recover their health because they'll look at the cause. Some people will cover up the symptoms and they'll have a reoccurrence later on. And some people won't survive. That's the sad fact of the matter. Typically, most of us enjoy a childhood or an early adulthood where we're spending, and we haven't had any obvious signs yet. But then, early 30s, late 30s, 40s, depending on the person, the body's gone, hey, you've spent all your health back. And so I really encourage people to change their definition of health from something based on how they feel to something based on how they function. And it's not difficult. Put a minimum of time into learning that. Make conscious decisions, even if they're the wrong ones. I would just want people to make conscious decisions in regards to emotional, chemical, and physical decisions. Your body will do what it does best, and that's heal, function.
Do you believe society is catching on?
I believe a small sector is, and that really, really excites me. I feel that there's never been a time that's more challenging in regards to the difficulty to get good quality food, the abundance of information, and a lot of it's contradictory. If someone's looking online, it can be really confusing. So where do you go? The fact that really well-meaning, and these are colleagues of mine for years, people in the medical profession are specialists in urgent care, emergencies, and saving us when we're in a crisis, thank God. However, by being labelled in the health profession, it's very confusing for a lot of people because they believe that on the other side of that suppression or passing the crisis, the suppression of symptoms, or the crisis, I should say, that they will have health advice. And they don't. So that's the other challenge. Where do you go to find a true health professional these days? So if I'm going to loop it back to the chamber, what I've noticed after buying this chamber for myself, okay, because I'm fascinated by health and I want to be functional, happy, and unlimited as I am now. I'm 56 and I feel better now than what I did at 30. As I just said, that's not the definition of health, but that's an important marker for me to be able to do everything I love doing. I want to be like this at 90. So I bought this chamber for myself. And then I work from home. I work in a little studio, which is a great way to work. And I started sharing this chamber with my clients and noticed that, oh my God, this is such a potent tool. It's so powerful. So that if we're looking at some of these challenges, as we mentioned before, people living in cities, etc., or the whole thing around information, and we take it back to the basics and we go, you know what? I'm in this situation, it's not ideal. It's a busy, polluted city, let's say New York City. However, I can buy a soft cell chamber for home, or there is a centre there that has a mild hyperbaric oxygen therapy chamber. Wow. It's a huge compensation for so many of the toxins we're exposed to due to the fact that almost every organ system benefits, whether it be the liver, as I said before, to detox. Because most people think about taking nutrients in. And most people, if they're getting health, they're thinking of that. Very few are looking at the elimination of toxins. Yeah, and you've got to look at both.
That's true. Yeah, completely true.
Yeah. And then the fact that if they are dealing with a condition, well, to know, for example, let's say around my area here, there's a lot of humidity and a lot of people come in with mold toxicity. You actually see that in their blood as well. Wow. That responds really fast when oxygen under the percentage, the levels that we get into the plasma, because that's where a lot of it's hosted in the blood, they respond incredibly well. They say, I've got my brain back. I wake up this morning with this position. I want to go up to the lighthouse. We've got a lighthouse here and everyone loves to go there. And I haven't been able to do that for years or whatever. We can pick things such as mild hyperbaric oxygen therapy. You mentioned red light, which is great. Okay, if we can't get sun and we're in the winter months, then we must get our D from somewhere and we must get the effects of the red light that we would get from sun from somewhere. And a red light bed has many functions, but one of them is to stimulate the mitochondria of the cells. So it's a really good adjunct with a hyperbaric oxygen therapy chamber.
To me, they all function together, which is functional health.
Exactly. Yeah. Isn't it funny how we function?
Can you explain to people that might not have heard of what functional health is or functional medicine and maybe compare it to what they're used to, the healthcare system?
Sure. Okay, so let's build on that definition before where we recognize that really well-meaning medical professionals help people get out of dire situations, emergency situations, crisis, etc. It's a little bit like us having a home that unconsciously, okay, or unintentionally, we allow to degenerate to the point where the electrical system, has a short circuit, where there's termites or whatever that's become conducive to a fire. When it catches fire, we're not going to call a carpenter. We'll call a doctor. We'll call the fire brigade. We'll call the fire brigade, which would be in medicine a doctor. They'll come and put the fire out. That's allopathic health, allopathic medicine. However, if we're looking at a functional side, we'd be looking and dealing with people such as people to inspect for termites and dealing with that, electricians, carpenters, if there's rotty wood, minimizing the risk of fire, but not only that, optimizing the actual function of the house or of our body. Now, what we've got to understand is that back to this idea around symptoms, by the time most symptoms appear, the problem, the dysfunction has been there for a very long time. Our body is not always, or I should say very rarely, efficient in advising us that there's a problem. Okay? The light of a car is much better when there's no oil, it tells us straight away. However, look at the spine, for example. Many people have spinal degenerative problems for years and decades, and you can see it on an X-ray or an MRI because they've got osteophytes, bone spurs, very little disc, and they'll tell you, and I've seen this hundreds of times, my pain only started last week. You're like, how's it possible that your body was there before? Or how's it possible that, let's say a particular breast tumor took 10 years to grow to 1 centimetre. How's it possible they didn't know beforehand? Because who knows, maybe they discovered at a certain time that coincided with a stressful event in their life, that coincided with no exercise for a while, no vitamin D from the sun, whatever, a perfect storm of situations there that, boom, let it metastasize without time to be able to just deal with the original tumour. So functionally, what are we doing? We're looking at function and we're recognising the fact that in general, there's one cause of disease, okay, besides a very small percentage of genetic causes, and that's lack of health. So once again, we cannot focus on the health if we're in a functional point. We should always and consistently focus on the function. Once again, breaking it down to chemical, physical, and emotional. And the beautiful thing, once again, when I'm in that chamber, when I'm in the red light bed, I'm benefiting on every level. Like it was funny, before I got the chamber, I've got quite an advanced degeneration in my low back. I've had surgery before, and there's an osteophyte growing into the nerve root on the left side, the sciatic nerve. And I actually got into the chamber. By the third session, there was no more numbness and pins and needles in my foot. Is it good for life? Of course it isn't. I come and exacerbate and aggravate it sometimes working, but I had that sign just how important and powerful oxygen is. So what we want people to understand after this is that if you focus on the essentials of health and you sit back and you minimize toxins or reduce them totally or remove the ones you've got in your body that we've accumulated from many sources over the years, then hopefully your body will do what it does best and heal, get you stronger, and get you to a point where you're less limited than ever and more capable of doing everything you want to do. And that's function.
How do we find out what our toxicity is? What is the underlying issues we have that we don't know we have? How do we find out?
Yeah, really, really good question. Okay, so if we start with your basic functional blood tests, and you can do that easily working with a functional medicine doctor, depending on what country you are. You can do a lot of this online now as well. You can do your research and find out what test you need. So that's a really important start. The other thing I'd say is find out what your single nucleotide polymorphisms are. That's your genetic mutations. That's really important as well. So you've got info there to help you focus on, whether you need to complement or supplement certain nutrients that are deficient. Then what you do is recognize that most blood tests, for example, that we get are actually disease markers. So it's very, very difficult to measure health. Okay, I talked about live blood microscopy. That is a really good way of measuring. It's not diagnostic. But we can see, for example, if your blood's hosting parasites or mold or other things. But it's also not the be all and end all. I think the most important thing here is understanding the philosophy. Okay, because there's also things like your sleep technology that will give you an idea around your heart rate variability, your deep and REM sleep. This is an exciting thing. There's really great advances in technology now. We have access to other ways of measuring these things. But do you know what? Independently of what you measure or what's negative, you'll always have to come back to those basics that I explained. Like being aware of what toxins are. Okay, I choose to, when I go shopping, buy organic produce. Or if I know that I don't have access to it, how can I remove any pesticides that might be on it? Or glyphosate in the States is quite common, so how's that affecting the wheat and therefore the bread that I eat? You know what I mean? Like going a little deeper and compensating for that. Sometimes in some conditions or some situations, it really is worth eliminating it totally. Once again, I want people to make conscious decisions. And if they're out and traveling or whatever, okay. But always bring it back to the basics. Understand that they've got to look at their lives also and go, well, for how many years did I take the contraceptive pill? Or did I take some medication? Or did I party in my 20s that went into my 30s? And is there some sort of compensation I need to do there? Was there another chronic medication that I took for a long time, or medication I should say that I took for a long time, that quite possibly requires my liver to get a little bit more attention? Have I had a whole series of antibiotics that requires my gut to get a special attention there? Am I carrying a dysbiosis? So I know if we're talking to people right now that have zero concept of this, I know that it seems daunting. But what I can guarantee everybody is that it's not rocket science. It really is back to the basics. It's a bit like I speak a couple of languages, and before I learned my first language, Spanish, I was like, wow, I'll never learn this. And then you start accumulating a few words and you go, oh, okay, I can get by with this. And then you add to that bit by bit. It's similar with health. There's the foundations that will seem challenging at the start. It won't take long to learn. And then with time, you can delve into it. But it's also gone full circle where there's all of these ideas and modalities about increasing health, but it really is back to the basics.
Okay, the basics. As you probably know, we just changed the food pyramid. I'm telling you, I mean, do you do all plant-based? Do you do meats? Do you do keto? That's what we're dealing with, though. That's the problem. What is the basic anymore?
What I propose to you, who made that food pyramid originally and who changed it? Was that the Fire Brigade? Do you know what I mean?
Say that one more time.
Who devised the food pyramid originally and who changed it recently? Was that the Fire Brigade, using my analogy before?
Right. I don't know if you'd call some of them the fire brigade, but
okay, was it more of a allopathic medical system? But anyway, we've got to really break down who gives what advice, yeah. And if we're looking at health, all right, these are the specialists that I'll listen to in regards to health. What are the genetic needs of my cells? Okay, so food-wise, it is confusing. I've been confused as well along the way. There's no one size fits all, but there's a few basic rules. I like the idea of a company called Viome, Viome.com. Viome, with a fecal sample, will be able to tell you what your superfoods are, what foods to avoid are, what foods you've got to have in moderation. It'll give you a whole list of markers from gut health to butyric acid to all of these other really important markers that show you I'm giving my body what it needs, because everybody's different. Everybody's different. And what they do is test the genetic needs of the RNA of your bacteria. So that's incredible, isn't it? Like the genetic need of the bacteria in your gut. That's how we should eat. But I think in a general form, if we treat our body a little bit like, let's say I'm looking at my garden right now and I know that if those plants are growing well, it's not because the plant's good. It's actually getting its nutrients from the soil. And if we're looking at what constitutes the definition of good soil, it's actually the bacteria that the soil hosts. So if I want to come along and spray pesticide on that soil, well, I can't expect good quality soil because it's got to kill the bacteria. And therefore, the plant that grows from that, which in our case is our body, because we have 10 times more bacteria in our body than cells. So we have to eat for the cells. I really like this concept. And no, when I say I like it, it makes sense. So back to basics in that regards. But if we were keeping things simple, we know that sugar, we've got to avoid it. Okay, sugar really, it's pro-cancer, it's pro-disease, it's pro-inflammation, it's pro-feeding mold in your body, candida, pro-parasitic dysbiosis. Okay, there's a few basics like that. Seed oils, there's enough info around these days for people to go and look at that and make their own minds up. But if you can cook in another oil other than canola or a seed oil, why not? Minimize your toxins where you can. You will actually see this yourself. I run a fasting group. We water fast 3 days every month. Now, how this started was just 6 male friends of mine wanting to see how regular fasting could affect inflammation levels, inflammatory levels, because inflammation doesn't necessarily come from our diet. It can come from, elevated and prolonged levels of cortisol, which is my case. I'm physically active, non-stop, for 10 hours a day. It could come from what I like to compare an inflammatory load, which we are contributing to since we are born, from many factors. It could be, as I said, antibiotics, it could be poor food, it could be certain medication, it could be stress, it could be an old injury. But imagine a glass of water filling up bit by bit. But unless it's spilling over, we're not symptomatic yet. But when the last thing happens, which could be a trip overseas or a dodgy meal somewhere, we become symptomatic because that inflammatory load can't tolerate that. But most people operate in that zone of lowering it a little bit so they're not symptomatic anymore instead of getting that load down. Okay? Once again, what I've learned with the mild hyperbaric oxygen therapy chamber, my goodness, how it deals with inflammation. Whether it be like an 80-year-old woman who's just had a fall and her ankle's this big and she's in the chamber and it's gone. Of course, there's a process, so the next day it might come back up again, but there's visible signs, skin problems, being bloated, post-injury, post-surgery, all this sort of stuff. Incredible. But we need to look at that as well.
Really quick on inflammation, since you brought that up.
Yeah.
It's not just something you can see. It can be internal as well.
Internal, totally. Yeah, I would say more of it's internal. By the time that we see things, we can pretty much assume that it's been internal for a very long time, unless it was a direct event that we can attribute to that. Think about, for example, I mentioned before live blood. It's quite common that people aren't getting up and hydrating. They get up, they might jump straight into their first coffee or have a glass of water. Plasma is predominantly water. We need to give our body good quality water in order for the plasma to be able to keep those red blood cells separated. So when there's aggregation, due to one of the causes being dehydration, oxygen can't get to that cell. So pro-inflammatory cytokines build up. We're not getting oxygen to the cell, therefore the cell can't do its job. You can see how there's a full cascade of reactions off this. The liver, if it's not metabolizing, not doing its job well. These days as well, there's a lot of thyroid problems. It's hormonal. There's a whole interaction between all of our hormones. So all of these can contribute to that inflammatory situation. And once again, I did suggest to people not to focus just on the inflammation because it is a healthy reaction of the body. Look at what caused it. Look at getting those things in line and your body will do the rest. But, a lot of people do recognize that inflammation is one of the first important processes in a process that will take somebody towards cancer. And that's just not cancer. It's autoimmune disease, it's degenerative problems, so many things. How many of us have our brains dealing with a degree of inflammation continually due to the factors we're exposed to during life? I deal with a lot of manual tradespeople, solvents, electricity, radiation, wow. But once again,
it's all over.
yeah, but we're born with this beautiful health band. We're just not taught how to invest it and save it. Spend, 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 spend. Oh, I'm okay because it's always been okay. No, we can't go on that premise.
It's crazy, isn't it?
It is. It really is.
I do have one more question from the chiropractic side. You worked with all the pro surfers. What is something, what would be your simple go to for all those people sitting out there from a physical side?
Yeah, so I've worked with a lot of athletes and UFC ones, pro surfers, footballers in South America. Look, do you know what? My answer now would be different to what it was 20 years ago. Back to inflammation. If you're dealing with an injury or dealing with a lowered state of function, look at your inflammatory levels, which you need to look at your levels of stress, how you're sleeping. Sometimes it's, toxic relationships or unresolved problems from the past. It could be something in your diet, too much sugar. Are you drinking alcohol still? Whatever it is, that is a game changer. It's not only professionals, but it's also the people I deal with. I'm just nodded that way because my table's there. On the table, there's people that I see that improve and regain their function really fast. It's almost always the ones who've got their diet, their mindset, everything else in place. And the ones I'm struggling with are the ones that still don't get it. Their inflammatory levels are way too high. So that'd be an important one. And the other one for athletes that I'd say, and that I'd apply to anyone, please don't play or work or function through pain or symptoms. Always take the pain and symptom as the sign that it was always intended to be from the brain, just like any other normal reflex. Hunger or sleep provoking is to eat, or tired is to sleep. Take it as a sign that there's a dysfunction. We need to go and find it and correct it and not cover it up. That's probably the number one problem I've seen over the years with problems that have started minor and exacerbated and degenerated, slowly, covered up sometimes by natural interventions such as acupuncture, chiropractic and others, or medications, to the point where, oh my God, I can't practice what I love doing now. And if we're talking about sport, apply that to your life. Go out living. Go out living. Please do what you've got to do to guarantee that continues the way it is. Or if you're not in that state right now, believe it's possible.
But you need it all, don't you? You need to do it from the nutrition, the physical, I'd like to say the preventative side.
Totally. It'd be like saying my car, it not only needs fuel, I need to go and make sure the radiator's full of water. I need to make sure the filters are changed. I need to make sure the oil is changed regularly and it's good quality oil. I need to make sure I use my car, but I don't drive it into the ground. You know what I mean? There's a lot of similarities. If we think of our bodies in regards to a machine or a car, it's a little easier to accept that idea that you've got to do it all. And once again, I know that the whole passion for hyperbaric oxygen therapy has come through strong. And I will say this passion, I had this degree of passion 30 years ago, 35, when I took chiropractic to Peru and Brazil. It drove me on to go and do social campaigns up in the Andes. And I just love the idea of getting something new to people. I haven't felt that degree of excitement for something until now with mild hyperbaric oxygen therapy. Because everything we've talked about today can fast track people to a higher state while they are also getting everything else in their lives aligned.
Will it become mainstream? Will it be, instead of running to the swimming pool, you go get hyperbaric oxygen?
Yeah, you know what? I think it is. I really do, because I've been doing saunas and ice baths for about 10 to 15 years. And what I'm seeing in the time that they've evolved to being safe, non-hospital, domestic, or in clinics, and that's due to the ability to hold a higher pressure with supplemental oxygen, wow, it's getting so much more attention. And actually, we've just opened a centre in Australia on the East Coast that has 4 chambers and a red light bed. Most people, almost everybody coming in already know about it. And they know that when they come in, It's a bit like having a plant that hasn't been watered for a very long time. We all represent, I should say, a type plant can all represent our state of health. You can imagine someone who's chronically ill, someone who's dealing with cancer or something worse, they'd be very dry. And if you and I are functioning pretty well, we've got basics of health in place, we are still dry to a certain degree, but it won't take as long to saturate. Now, let's imagine every time you're in the chamber, it's similar to giving 10 mil of water to those plants. Obviously, the healthier plant will need less sessions. It might be 10 or 20 10 mil doses. But, typically someone with cancer, the gold standard is 40, 60, 80 sessions. So yeah, we are going to see this because people are getting sicker and sicker because they're not focusing on the true definition of health. And we are really seeing this crop up very fast. It's growing fast.
Over here, we're seeing a lot of younger people getting it, and it just came out that younger people are not going to outlive their parents for the first time.
Yeah.
It's scary. So
Yeah.
to me, we're out of time. It's that change. We need to get moving and start getting healthy.
We do, and it doesn't have to be the case with the parents. I think a parent who wants to be alive and active and enjoying their grandkids and maybe their great grandkids has to learn that they can't follow what they've been doing. It's just we've evolved. We know so much more about it. Remember, the people giving health information are no longer disease specialists. There's other people out there who solely focus on health, and they're very different entities. They're very different. But once people accept that, and if they're following a health journey, or a sickness journey, why not work with both? Do you know what I mean? As opposed to many people just working with the disease specialist, the best they can hope for is that they'll get a suppression of their symptoms and maybe a cessation of the disease, but they won't necessarily be in a healthier state, and they won't have looked or been encouraged to look at the underlying causes of that disease.
That's awesome. I mean, it's that simple though, isn't it?
And look, please, people, anyone listening, take it. That's the underlying message. It's that simple. I know it's hard. I dealt with my mum when she was diagnosed with cancer, and even though I had this knowledge, my brother basically gave us 2 tickets and said, just get the job done. I'm like, mate, my mum smoked for 16 years and she's got late-stage lung cancer. So you can imagine I was just trying to throw everything at her from all angles. So it's not easy to think under those conditions. Please don't wait till your health bank account is bankrupt. Invest now. Actually, Harvard University did a study, I think it's about 12 to 15 years ago now, that showed that any investment in health will give you a 2,000% return on your money. So if you're not feeling sick today, it doesn't matter whether it be financial or time investment, you'll get a much better return on your money than Bitcoin, property, stocks and bonds, whatever. There's no better investment.
Take responsibility for yourself now.
Exactly.
I love it. Jason Gilbert, I mean, absolute pleasure. I hope I can have you on again, honestly.
Thank you very much for the invite. It's been my pleasure as well, mate. Seriously.
No, I really appreciate it. All right, folks, that was it. As you guys know, find the attitude, keep the attitude, go out living. Bye now.